Well, hello and welcome or welcome back. My name is James Coplan, MD, and this is my ongoing series entitled Autism Spectrum Disorders in Three Dimensions. If this is your first visit, a special welcome to you, and I encourage you to go back and look at some of the first 12, or rather the first 11 postings in this series to get yourself grounded and caught up. And if you've been following all along, I'm glad to have you back. Tonight, we're going to begin talking about some of the specific features of autism spectrum disorder in a bit more detail than we have up until now. What I've dedicated the first dozen postings to was first a history of people like Leo Kanner, George Frankl, Hans Asperger, Uta Frith, Lorna Wing, and their contributions to the concept of what we think of when we say autism spectrum disorder, as well as then trying to put that into a three-dimensional frame of reference for you that encompasses degree of atypicality, level of general intelligence, which is not part of the diagnosis of spectrum disorder, but which is a cofactor that impacts the rate of progress and long-term prognosis over time. So my 3D model provides you with a way of thinking about degree of atypicality, level of intelligence, and passage of time as one cohesive model. Tonight, we're going to begin drilling down, as I've said, talking about specific symptoms or signs of spectrum disorder and the underlying neuropsychological traits that presumably give rise to the visible symptoms. But I'm going to start by telling a joke. Now, I've often had fantasies of being a stand-up comic. I've never given it a try, and I don't promise much here. But I'm going to tell you a joke by way of illustration of the topic of theory of mind. And it goes like this. A little boy, let's say he's about 5 years old, he plays hooky. Now, it's hard for a 5-year-old to play hooky, I know that, but let's just say he stays home from kindergarten and he plays hooky. And the phone rings at his house. And his mistake is that he picks up the phone. And who should it be on the phone but the vice principal for discipline? And the vice principal for discipline hears the tiny little piping voice at the other end of the phone and immediately becomes suspicious because he was calling to see where Johnny was. Why wasn't Johnny in school today? But when he hears the little voice, he says, "Who am I speaking with?" And the little boy, realizing that he's been found out, but hoping to evade the situation, deepens his own voice as much as he can and says into the telephone, this is an old joke because telephones in those days were a receiver like this, and he says into the telephone, "This is my father speaking." Well, I can't hear you laughing or groaning out there, but the joke is funny maybe a little bit the first time you hear it. And what is it that gives that joke? It's humor. The little boy hopes to avoid detection. He hopes to pass himself off as his own father. Notwithstanding the fact that a 5-year-old can't really deepen their voice that effectively, and dad would probably be at work at that hour anyway. But the real humor in it is that the boy gives himself away because he says, instead of saying, "This is Mr. Smith," he says, "This is my father speaking." So he wants to tell a fib, but he doesn't quite know how to pull it off. And that ability to pull off a fib requires theory of mind. And that joke is by way of illustration of what I want to get into for the rest of this post, which is going to be all about theory of mind. And unfortunately, for children and adults on the autism spectrum, difficulty with theory of mind really is no joke, and it leads to some fairly serious problems. And that's something that I want to kind of segue into. So why don't we jump in? So for those of you of a certain generation, And I age myself here, but if we go back to the 60s, this may be familiar to you from the animated Beatles film Yellow Submarine. So this is a cartoon depiction of a submarine, and I have chosen this as our metaphor for the difference that I want to establish between visible features, which constitute the what of autism spectrum disorder. And the what of ASD is basically a list of symptoms. And there are a variety of symptom checklists. I've listed a few of them here. The DSM, which is the Diagnostic and Statistical Manual of the American Psychiatric Association. IDEA actually stands for the ACT, Individuals with Disabilities Education Act. So there are various educational criteria. Then there's ICD-9, which is the International Classification of Diseases. And then there are a variety of proprietary tests. And I mentioned last time the CARS, which is the Childhood Autism Rating Scale. There's the ADOS, and there's the MCHAT, and a variety of others, each of which has its own particular flavor of how it's administered and the relative emphasis that it gives to different outwardly visible features. And they have their uses, although they also carry their dangers, because one does not wish to become mesmerized by the results of a particular test. The real test, in my view, is still a well-taken history by a seasoned clinician who knows what they're looking for. But that's a story for another day. Suffice it to say, for the present purpose, the conning tower with the tip of the periscope and whatever else that's projecting above the water are the what, the visible signs and symptoms, the outward features. But the money is all down here, really. And one of the key elements down here is the underlying neuropsychological traits. And this is the why. The why. Why do people or children or adults with spectrum disorder display the features that we use up here on our little checklist to check all the boxes? What's going on under the surface that leads these individuals to act in the way they do? So the neuropsychological profile has explanatory power. The symptom checklists are merely descriptive. They don't explain anything. No matter how good the checklist is and no matter how popular it is, it really does not have explanatory power, whereas neuropsychological accountings of spectrum disorder have the ability to explain and or to predict, and predictions are testable. And if we understand the underlying neuropsychological mechanism behind a certain behavior, then that may lead to some specific forms of intervention. And I'm thinking right away of something like Carol Gray's Social Stories or Jed Baker's illustrated books for children and adults on the spectrum about social skills, and a variety of other materials that we'll get to when we talk about intervention. So the first area of symptomatology is impaired social interaction, and this is on all the checklists. I know DSM-5 has combined that with language, but as I said a time or two ago, I'm a crusty old curmudgeon, and I give myself permission to still pull social interaction out and look at it separately from language, because I think that's warranted. That being said, now I will leave that pet peeve aside and say that we know what some of the things are that are on that checklist, things like poor eye contact. I had one mother who told me in the office, I breastfed my son for the first 9 months, and in those 9 months he never looked up at me once. And that really tore my heart out. I just can't think of anything more poignant and more painful than what that mother was describing. Difficult to engage. Another parent said to me in the office, or actually wrote it down on their pre-visit questionnaire, our child lives among us, but not with us. And again, that's a very finely tuned distinction. Our child is among us, but not with us. And the phrase, Johnny's in his own little world, is actually a term that Langdon Down, and I'm afraid I left him out of my litany of contributors earlier in this post, so let me add it here. Langdon Down in 1855 observed children that, in his own words back then, lived in a world of their own. So this phrase has been with us for a long time. And limited peer interaction. Asperger and Leo Connor both describe children as being on the periphery of a peer group, but never actually playing interactively with other children. So these are the visible features. But what's going on underneath? And the first of several traits that I want to talk about is something called theory of mind, or decreased theory of mind. Now, I just told you that joke about the little boy who said, "This is my father speaking," because at age 5, children don't have fully developed theory of mind, which is why they sometimes blurt things out that adults may find quite amusing, because kids don't yet quite know how to pull it off. So what is theory of mind? If we give it a formal definition, it's the realization that other people have an internal mental and emotional state which may be different from my own. So that's really a two-part proposition there. First of all, that you, unlike the chair that you're sitting on or the table that you're sitting at, you have an internal mental and emotional life. That's the first part of it. And second of all, your perspective may be different from mine. So there's a lot packed into that sentence. And then the second part of it is the ability to gauge the internal mental and emotional state of the other person in real time. Now, I can't see you sitting there, but if I imagine that you've got your arms folded across your chest and you're kind of looking off and to the side and you're tapping your foot and you're making heavy sighing like maybe you're bored or angry and you want me to change the subject. That's the sort of thing that we would tune in on if we were face to face. It's really hard to do that via the internet. I will tell you another funny story, though. My wife is a physical therapist, and at one point she worked in the public school district at a time when I was at the university hospital running a diagnostic clinic, and I saw a little child, and I made a diagnosis, and the mother was very angry with the diagnosis. She was very angry with me shooting the messenger. She never came back. But a couple of years later, my wife, who was working in the school district as a PT for the schools, came home one night. She said, "You'll never guess what happened. This mother came in with her child. She saw my name tag, and it was the same mother because my wife shared the name with me. And the mother folds her arms across her chest and gets all steamed up and begins tapping her toe. And she says to me," says my wife, "You're not related to that Dr. Coplan, are you?" To which my wife responded, "Only by marriage." So my wife had good theory of mind skills. She could see right away that this lady was really angry with me and prepared to be angry by extension with my wife, but she gave an answer that kind of defused the situation. So theory of mind is that realization that other people have an internal mental and emotional state which may be different from their own. This other woman, the mother of the patient, clearly didn't have the same opinion of me that my wife did, although at times my wife has felt the same way about me, I have to admit. And my wife was able to gauge the other person's state and come up with a saving answer. So theory of mind is what underlies empathy, and toddlers, even infants, but certainly toddlers, are able to read their parents' moods. This is very clear. Humor, the ability to tell a joke or the ability to recognize a joke. If you've ever been sitting with a child with neurotypical development and reading a storybook, and the child is, let's say, 2.5 years old, and there's a picture of a horse, and you say, "Look at the cow," the child is going to look up at you with a sly look and say, "No, you're silly, Daddy," or "Mommy," or whatever, because the child knows that you're saying something incorrect to mess with their head, in other words, for fun. And they know that. And they get that. And humor is one of those things that emerges around 2.5 to 3 because children's theory of mind skills are really budding at that age. And the other things that emerge around 2.5 to 3 are make-believe and fibbing. In order to tell a fib, you've got to be able to get into the other person's head, figure out what you can do to misdirect them, and then get back into your own head and do it, because a lot of jokes depend on misdirection. You set up an expectation in the listener's mind that you're going to take the story in a certain direction, and then you take it in some other direction altogether, and it's like you put the banana peel under them and they fall, but they laugh, because that's what the joke is. You have misdirected them. And critically, theory of mind is what underpins our ability to infer motive and to predict the behavior of others. If we couldn't infer the motive of other people, then their behavior would be unpredictable, totally random. It would be like being parachuted into an alien culture where you had no idea what the customs were. Am I supposed to give eye contact, not give eye contact, shake hands, not shake hands, and so on, and you would be utterly lost. And unfortunately, that's the case for a lot of kids and adults on the spectrum, and they have to work very hard to find other cues to guide their own behavior. Here's a cartoon that rests on the same premise as the joke. In this cartoon, we see the two little boys. He's about 6, and his younger sister's about 4, and they're playing penny ante poker with Grandpa and Grandma. So the little boy says, "I'll raise you a penny." And the little girl goes, and she leans over to Grandma, and she says, "Grandma, what should I do if I have 4 in a row and one of them blah, blah?" So in other words, she doesn't quite have a straight, which would be 5 cards numerically in a row, like 3, 4, 5, 6, 7. That's 5 cards. And the grandma whispers in the little girl's ear, "Well, when you don't quite have the cards that you need to play a strong hand, you can try bluffing." And the little girl turns back to the other players and she says very grandly, "Okay, I'll bluff," which is exactly the same as the little boy who said, "This is my father speaking." In other words, she knows that she wants to fool people, but her theory of mind skills haven't quite come far enough along to enable her to do it. Now, this is funny in a way, but I remember one of my patients, a little boy who had very limited theory of mind skills, and anytime his sister would start playing make-believe, this little boy who was very literal would run to his parents and he would say, "Mommy, Susie's lying again," because all he knew was that if you said something that wasn't true, it was a lie. He had no idea about things like humor. So here is a reading paragraph. This reading paragraph is from the 1934 edition of the Durrell Graded Reading Paragraphs. It was used as a reading test back in the 30s when FDR was president. And I used this book in my office because I could use it without fear that I was going to be intruding upon any currently in use diagnostic instruments. I promise, I wasn't in practice when FDR was president. I wasn't even born, but this book came in very handy. So here's the first grade story. Muff is a little yellow kitten. She drinks milk. She sleeps on a chair. She does not like to get wet. Well, I would give this story to the child, if the child was able to read, and I would have them read it. And then I would say to the child, "How would Muff feel if you gave her a bath?" Now, that's not in the story, right? It's not in there. It doesn't say. And then you've got to be able to put 2 and 2 together. Well, if she's just gotten a bath, per my question, and you say to the child, "How would Muff feel if you gave her a bath?" It says right here she doesn't like to get wet. You've got to be able to put those things together and see the experience from the cat's point of view. Not what this child said to me, which was clean. Well, yeah, objectively she's going to be clean, but it misses the point of the conjunction between the story and my question. But I think the saddest answer came from a child who said to me, "I don't know. We haven't read that part of the story yet." Very literal, no theory of mind skills. And the striking thing is, this is a 6.5-year-old boy whose measured IQ was in the superior range. His IQ is in the 130s. For the items on the IQ test, which is things like shapes and numbers and geometrical patterns, he was getting in fights on the playground. He was being judged as very rude by the teacher because he would not respect social bounds. But the problem is he didn't understand social bounds because he didn't have theory of mind skills. He was not even able to integrate what it says here. She does not like to get wet with my question. He couldn't integrate those things, and he gave a very literal answer. I don't know. We haven't read part of the story yet, that part of the story yet. So imagine this little boy on the playground trying to infer the intentions of other children, or in the classroom trying to monitor his own behavior and to say to himself, uh-oh, I better not say that. I'll get in trouble if I say that. There's another joke which goes like this. How do you act smart? How do you come across as being smart? And the answer is, think of the dumbest thing you could possibly say and then don't say it. Well, that presupposes your ability to do that, but he didn't have that ability. He didn't have any way of gauging what was over the line because he couldn't see that there was a line. Here's a third grade story. 6 boys put up a tent by the side of the river. This is camping. 6 boys put up a tent by the side of the river. They brought things to eat with them. When the sun went down, they all went into the tent to sleep. In the night, a cow came and began to eat the grass around the tent. The boys were afraid. They thought it was a bear. So I have the child read the story. And the parents are sitting there observing as I do this so that they can see what's going on. Because sometimes it's not clear to the parents what's going on. Sometimes it's not clear to one of them. So the child reads the story. And then I say, well, is this supposed to be a sad story, a scary story, or a funny story? Now, this is the double theory of mind task, because first, you've got to be able to appreciate, you've got to have empathy for what's in the boys' minds. But then you've got to take it another level because you, as the reader, have access to more information than what the boys have in the story. So you need to have, first you need to be in the boys' shoes. Oh, gee, they must have been afraid. Well, it says they were afraid. So is this a sad story, a scary story, or a funny story? Well, it's supposed to be. What is it supposed to be? We know it's not a bear, right? So for us, it's pretty lame humor, but it's supposed to be a funny story, right? Well, so a lot of kids on the spectrum would say it's a scary story because the boys are scared. They can get as far as being in the boy's head, but they can't take it back another step to realize that we as the reader know more than what the boys know in the story. And then the most striking answer given to me by a child with Asperger's syndrome, in other words, high functioning spectrum disorder, hyperverbal, normal general intelligence, socially intrusive, physically awkward, and socially maladroit, said this. It's a most unusual story because you don't often find cows in the woods so far from the barn. And we may laugh, and whenever I would give this talk to an audience of people, educators or whatnot, there was almost an involuntary ripple of laughter because the answer is so unexpected. But this kid was totally at sea. He had no earthly idea of what the boys were feeling or what he, as the reader, nominally ought to be feeling, which is that this is a punchline. They thought it was a bear, and it's supposed to be for us funny. He had no idea at all. So here is, I don't know if any of you would know who this was. This is an actor who was one of my faves. He died relatively young of cancer. This is Steve McQueen. And Steve McQueen had a lot of great roles. If you've never seen the movie The Great Escape, which is about American Air Force pilots and RAF pilots who've been imprisoned by the Nazis during World War II and how they, well, I won't give the plot away, but he rides a motorcycle in there, and he was an avid motorcycle rider. He did his own stunts for that film. Great film. In this movie, he's in a Western. You can tell that, I think, by this guy over here is smoking a cheroot, and they've got cowboy hats on, and they're in a bar, and so on. And he's got some chips in his hand, and look at the look in his eyes. He's looking around the table, and he's somewhat more sophisticated than the little girl in the cartoon. He's trying to mask his own face, his own expression. He's trying not to give away any clues, while at the same time studying everybody else around the table to read their faces, to kind of get a sense as to whether he should bet and how much he should bet, and if he's holding weak cards, whether he should bluff. So there's an intimate connection between eye contact and theory of mind. And sometimes I don't know which is the chicken and which is the egg. If theory of mind is poor because eye contact is poor, or if eye contact is poor because theory of mind is poor. But they're joined at the hip. And nothing illustrates it better than this painting. This is a painting by the late Norman Rockwell. Norman Rockwell was a wonderful illustrator. He did hundreds of covers for the Saturday Evening Post. He did patriotic posters. Actually, some of his Saturday Evening Post covers were put into a commemorative issue. This one shows a boy atop a diving board, and I used to use these as flashcards in the office explicitly to tap theory of mind. So here's this kid, and I hope you can see it on your screen. He's bending down, he's clutching the edge of the board, his eyes are popping out of his head, his eyebrows are arched, his forehead is furrowed, and he's clinging to the board and staring, and it says here, I can't get the little arrow to work, it says high dive, 20 feet. And how does he feel? Well, we can see that he's terrified. But the little boy in the office said to me, I don't know. I can't see his mouth. And this is the most striking example that I have of how children on the spectrum don't know how to use eye contact, eye-to-eye contact, reading other people's eyes and the upper half of their face for all of the information that's in there. They're looking at other cues, and one of the things they look at is the mouth, and there's been a lot of good research done on this, which I'm not going to get into at the moment. On a future post I may, but this is a stunning illustration of that fact. And here's another example. I had a 15-year-old boy come in. He had no diagnosis. He had no individualized education plan. He was not getting any specialized instruction. And he'd been referred to me for a possible reading disability because he was having trouble inferring the meaning from stories, like that story about the boys camping, or the one that I'll show you in a few minutes about a boat. And he couldn't get the meaning of the stories. And he was referred to me to rule out a reading disability. So I had him in the office, and I had taken a lot of history, and I had a lot of his early history from back when he was, a toddler and a preschooler and an elementary school. And there were a lot of very germane and autistic sounding things in there, which I had kind of tucked away. So I was giving him a task that involved copying flashcards. Here's one flashcard. These happen to be from something called the Bender Gestalt, Gestalt. The task is to copy them with pencil and paper. Each card is about 5 by 7, and you give the child an 8.5 by 11 piece of paper and a pencil, and they're supposed to copy the cards one by one. It's not a timed task. They can have as long as they want. They start out very simple. So here's the first one. Not necessarily the first one. And here's another one. This one gets a little more complex. And then here's another one, which is far more complex, so they start easy and get hard. And he was doing the cards very methodically. But he wasn't looking up. He wasn't looking up after each card. He would sit there with his head down, staring at the paper. So I was staring at the top of his head. And since I had his early history, I asked him this question. I said, did you know that there are two ways you can tell me that you're done? You can either say, done, or you can look up. There's a 15-year-old boy getting no help in school. And his answer was, no, no one ever taught me that. Well, that's enough to make you cry. I mean, here's a young man who, by my lights, had high-functioning autism spectrum disorder. He had really significant issues with eye contact and theory of mind and pulling the meaning out of stories when it was implied and it involved social material. And he was just drifting through, getting no help. He was so vulnerable. Happily, he had not gotten into fights. Happily, he had not been teased and beaten up on the playground. But he needed a lot of help. And if I hadn't had the background that I did, and if I hadn't had the early history that I had, I don't think there's one person in a million who would have asked him that question. Did you know that there are two ways to tell me you're ready? Three, you could say ready or done, or you could look up. And then he said, no, no one ever taught me that. So I began asking that question. I sort of stumbled across this by accident, but I began asking that question whenever I gave those cards. So I would give the cards to another child, and I would say, how am I supposed to know when you're ready for another card? And another kid said to me, quizzically, because my pencil has stopped moving, he asked it as a question because he didn't know. Another child, I said, why is it important to look up after each card? Hoping he would say, so you'll know I'm ready for another one. But he asked me to see if I got the right answer, again, asking it as a question because he's not sure. He doesn't really know. And then I say to yet another child, when you look up, what does that tell me? And he says that I'm paying attention, which, of course, I can hear the teacher's voice, pay attention, look at me, pay attention, which is usually what the teacher wants you to do. But within the context of one-on-one and giving a test, again, these kids all had no idea of that function of eye contact. And, one of them was 15 years old and not getting any help. And he had all the other accoutrements besides. So here's a 5th grade story, The Boat. Henry goes to, and I had the child read the story. Henry goes to a large lake in the summer. Last summer, a motorboat sank near his house. The man who was running the boat brought it very close to shore when the water was low. The boat hit a big rock under the water. The water came in very fast. All of the men swam to shore. Now, I'm reading it with a little bit of inflection, but the child might read it kind of robotically. Henry goes to a large lake in the summer. Last summer, a motorboat sank near his house, etc., like that. So the child reads the story. And I say to him, there's someone in this story who might get in trouble. Who is it? So this is sort of like, Muff does not like to get wet, or the boys were afraid, but it's embedded in there, but you've got to dig a little deeper. Well, Henry goes to the lake. There was a motorboat. There were 10 men in the boat. The man who was running the boat brought it very close to shore when the water was low. Well, that's not a very smart thing to do. So what's the right answer? The man who was running the boat. He brought the boat too close to shore. The water was low. He should have thought about that. And even if he didn't think about it, he was the one at the wheel when it hit the rock. And the child says to me, and this is, a kid in 5th grade, high IQ, getting in trouble on the playground, getting in trouble with the teacher for being lippy. And he says, Henry? The 10 men? He has no clue at all. And the asterisk is this. I asked the father the same question. I had worked with this child, the parents were not in the room. And after I had worked with the child, I sent the child out and I brought the parents in. And I said to them, I had your child read this story. And I asked the dad to read it out loud. And I said, and I asked your son, who was it who might get in trouble? And this dad was a very sweet man, but he seemed to be kind of not clear as to why his son was coming to see me. He kept saying, I don't understand why we're here. I don't understand why we're here. So I had him read the story, and then I said to the father, so Mr. Jones, not his real name, who is it who might get in trouble? And the man said, I don't know. I could never do stories like this. And his wife's jaw kind of fell to the floor. And I said to this man, I'm not going to diagnose you with spectrum disorder just based on something like this. But I think you're in a good position to help your son because your son is struggling with one of the things that you're struggling with. And I don't know because they never came back. I don't know what the ultimate outcome was for this family. But I do know, and remember, Hans Asperger spoke about this, Leo Connor spoke about this. There's ample research data to speak to this, that a fair proportion of the parents, or at least one or the other of the parents of a child on the spectrum, also has either diagnosable spectrum disorder or little fragments like limited theory of mind skills or associated mental health issues like anxiety disorder, OCD, mood disorder, etc. But clearly, this dad, who is a very sweet man, had some significant issues with theory of mind. And I suggested that he also get himself evaluated because there are things can be done to help adults. I don't know what the outcome was, but this story is really very telling on a lot of levels. And in future posts, we're going to talk about things like the family constellation and partial expression and associated cognitive and mental health issues. But those are all stories or subjects for another time. Well, that about wraps it up for this post. Once again, it ran a little longer than I thought it would, but I hope that you found the material engaging. So next time we will continue talking about underlying neuropsychological traits, and I'm going to introduce the term central coherence. So until then, thank you very much.